All right, so it's interesting. I would like actually to see what my health bot would look like, and I leave it up to you to explain at the end when we see the results. So one of the reasons that I'm really moving forward quickly with this presentation is because I want to see the results of the questionnaire. So tell us what you think. I don't know if Petra actually filled it up. She helped prepare it. Oh, you did. All right. Okay. So what I yes. Yeah. It wasn't actually a question answer. Yes. So I loved this slide. I thought that the patient will see you was kind of controversial, but the Gutenberg moment. Take a minute to think how the world changed when Gutenberg actually invented printing. They say that the same thing would happen to healthcare. That's what Eric Topol said, and I think it's true. It's true because we are having now new tools, and one of the most remarkable tools comes from the clinical trials area to show you how much power the doctors are called to release here, and how they are clinging to that power. So what's going on now is that patients of a certain disease or their families are organizing because, as Petra said, they have the data. And I'm not sure I like the idea of taxation, but they have the data. Even if the data does not belong to them, they have the data. And they have potentially the time to invest in the data and invest in cure more than any particular doctor would do, because many of these diseases involve different specialties. So look at this direction. Look at these organizations that engage in advancement of medical science through the use of data. The world is changing. So the same guy I'm quoting, and maybe it's boring, but one of the things that happens with old medicine and new medicine is that now we have individualized medicine. So as I said, giving that example, the people that have a specific disease can help address the disease for each individual member, for each individual child. And you can do real-time streaming like we do now, right? So there are potentially other people listening to us and objecting or agreeing to what we are saying. We have patient-generated data. We have notes where the patient may add to the notes of the professional. We have information, lots of it, more than perhaps we need or we can use. And this is a very well-adapted slide. You will see from the King's Fund 10 innovations that have appeared, and maybe you can recognize some with me. Let me get this. So this is my favorite in terms of giving data from implantable device. These are the social networks. These are teleconsultations. This is the Bitcoin. This is artificial intelligence, genomics, apps. Things are so different. And then we have these open notes. It is quite widely distributed as an idea in the US, where the notes of the professionals are actually open for the patients to see. You see also the excitement of the Society for Participatory Care, where people are actually looking for access to their data. And it started with somebody that had an implantable device and wanted access to their data so that they could correlate their life, their activity, their other devices that they are using, other sources of data with the data from the implanted device so that they can make sense of where their life or their choices would take them. And then, of course, this is the fun part. I'm actually participating in that, of the quantified self movement, where people are using devices. There are opening devices that are closed so that they can get the data and figure out, play. I do that with my Fitbit. It's fun. I found, for instance, that my heart rate is making a cycle every month. So there is a period every month that my heart rate is up and down and up and down, and it's periodic. I have to find more about it. Maybe I can learn something. So it goes back to education. What do I need to learn so that I can make sense of all the data that surrounds me? How can, in this disruption, in this change, have an anchor, a compass to move on? So it's a lot about the data. It's about controlling the data. It's about stewarding the data. It's about making sense of the data. I think this is the most important thing, using the data as a means to make our lives better. And this is where governments also participate. This is from the ONC, where it encourages people to actually get involved with their data. And you see different sources of data and the right to health information. But how do you do it? I mean, in the end, it takes a culture change. It takes trust. Anne talked about communication and trust, and an infrastructure that allows you to trust the system. I recently found that things like Airbnb or Uber have an implicit trust in the system, in the infrastructure that allows you to use services that you wouldn't otherwise use. So in this project that I would like to talk to you about, which is the eStandards project, we are trying to bring together different pieces and help create an ecosystem that we will understand the role of standards. Because up to now, the way we felt about standards was that it was stability. It was an afterthought. We found how you do things well, and then you modeled them, you created the standard, you delivered it, you tested, you labeled it. That's not the way, however, the world works when there is change, where there is immense disruption. We did a number of meetings and discussions, and we asked the people what they expected, what they liked, how they would like standards to apply to apps, what does interoperability actually mean to them. And we heard that we need to move to a more dynamic system. And this disruption actually is seen in different views and in different lenses. If I talk for HL7, for instance, you will see that HL7 itself is facing a disruption with the advent of HL7 Fire, because now the emphasis is on open interfaces. It's not about complete models, complete transactions. It's about give me access to the data. Give me the opportunity to make sense of the data. So in effect, and this is one of the main notions that I would like to share with you, as we are all collectively trying to understand what the digital compass is about, is that in this world of change, in this world of disruption, we have cogs that move in different speed. And we have things that are moving slowly, and we have things that move fast. Think of somebody that wants to create an app in the next afternoon. They want an interface now. They want to access the data. They want test data. They want test servers. They want them now. They don't want something perfect. They want something that will work, a proof of concept. This is how the world is now. But at the same time, you have to work with sustainability, with sustainable development. You don't want to create too much excuse me, garbage. So here, Gardner actually tries to interpret this model, talking about different systems, systems of innovation that are moving fast, systems of differentiation, which give you access to the market, and systems of record, which are for the long haul. Last slide. This is about the digital health compass. And there are different viewpoints when we look at standards and when we look at the digital health compass. And we are trying to figure out, actually, right now, how to put the pieces together. And we have selected 4 different viewpoints. The viewpoint of consumers, patients, that we are discussing today, the viewpoint of health systems that need to be sustainable and innovate and get things work. And they are, as you can understand, moving at a slower pace, more dependable. And then you have the market that wants to create profit. And you have the workforce that needs to be educated in a new way, in new needs that are also evolving quite fast. So with that, I would like to pass the baton to Ed, who will speak mostly about the last part. Ed, the floor is yours.